I'm Carol Reed. I'm the Program Director for the Needham Coalition for Youth Substance Abuse Prevention here in Needham. And I am fortunate today to have Dr. Kevin Hill from McLean Hospital here with us to talk to us about underage substance use and the impact on the adolescent brain and options and resources for treatment if you're concerned about youth. So thank you for coming, Dr. Hill. Can you tell us a little bit about the work you do at McLean?
Sure. Thanks for having me, Carol. I appreciate it. So I'm one of the addiction psychiatrists at McLean, and we have a large alcohol and drug abuse treatment program. So we have a variety of treatment programs there, from an inpatient detox to outpatient treatment at a variety of methodologies. So people can get counseling there, they can get medications. And so I'm one of the addiction psychiatrists there. I do a lot of clinical work at McLean, but I also do research into developing treatments for some of these substance use disorders. And so I have a grant from the National Institutes on Drug Abuse to develop medications for marijuana dependence. So right now, more people use marijuana than any other illicit drug, but there aren't any available medications that are FDA approved. And so we're running clinical trials now to try to develop medications that may help people who want to reduce or stop their use of marijuana.
Mm-hmm. I know that our mission with our coalition is to reduce underage substance use, and our primary focus is alcohol, marijuana, prescription drugs. And there's a myriad of research that supports our work today that we share with the community in Needham on the impact of substance use on the developing brain. And can you share a little bit, it may be first alcohol and then marijuana, if you would, or globally together, what your profession tells you in regard to the impact on the developing adolescent?
Sure. Marijuana is probably the most difficult for people to understand, because a lot of people feel that marijuana is not a problem at all. Even other physicians that I know ask me sometimes, wait, I didn't know that marijuana was addictive, and it certainly is. So as I mentioned at the top, more people use marijuana than any other illicit drug. So we're talking about millions and millions of people. Only a fraction of those people use in what we would call a very serious way, so meeting criteria for what we call marijuana dependence. But a small fraction of a very large number is a large number. So there are a lot of people out there that are smoking marijuana in a serious way, either daily or near daily, and they have distinct consequences. And so for kids that are using marijuana in a serious way, there are cognitive difficulties that they encounter. And so there's been work done at McLean. Dr. Harrison Pope did some important studies, and Stacy Gruber, Dr. Gruber is another person at McLean that's looking at these issues. And so what they have seen more or less is that the age in which a kid initiates use of marijuana is very important as to the impact that smoking might have upon their brain. And so, for example, Dr. Pope did a study that was published in 2003 that showed that really 17 was a critical age. So kids that used marijuana in a serious way multiple times a week before the age of 17, those kids are at much higher risk to have cognitive difficulties as a result of that use. And so those are reasons why we want to try to educate people and help them understand that marijuana is not a benign drug. So everybody knows people that have smoked marijuana and haven't had any problems. And we're not really talking about those people that use occasionally. We're talking about people that, up the ante a bit and are using multiple times a week or even daily. And if you do that, then you can have serious problems. And those are the kind of problems that we see at McLean all the time. In terms of alcohol, the way that I think about alcohol is that it increases the likelihood of impulsive acts to occur. So it puts you in situations that you wouldn't otherwise be in. And I think a lot of people have had experiences like that, and they kind of laugh about them, the silly things that they did, while they were drunk and that sort of thing. But unfortunately, those kind of situations at times end up very badly, and people end up hurt or killed. And those are things that we see. And people who, you mentioned binge drinking, and binge drinking, those kind of habits are the things that increase the likelihood of having a bad outcome. So that's why we try to discourage that, because we find that people will do things that they wouldn't normally do if they didn't have 10 beers. So that's where that's a problem. Opiates, again, kind of a combination of the two problems that we have with marijuana and alcohol. I think certainly opiates will increase the likelihood that you would engage in impulsive acts, but opiate use kind of has its own difficulty in that there's an increased likelihood for very fatal overdoses. And so that's something that has really gripped the Commonwealth in many ways. And so opiates are very strong medications, and they work in various ways. Some are metabolized by the body more slowly than others, and so kids don't really understand how that biology works, how the chemistry works, and people end up taking more opiate than they can tolerate. And opiates decrease respiratory drive, so if you take more opiate than you should, you're going to stop breathing. And so that's what's happened in many situations for people in the Commonwealth. And you talk about programs in the Commonwealth where they will give an antidote to opiates. And so opiates are very dangerous, and that's another thing that we try to work on at McLean. I think, I think we were talking off air earlier that at McLean, typically in our program, we see probably 40% alcohol problems, 40% opiates, and 20% everything else. And I think one of the reasons why we see more alcohol and opiate problems is because really dramatic events bring people into treatment for those problems. So they wrecked the car, or they had a near overdose, or that sort of thing. Whereas marijuana, it's kind of a more subtle thing. It's the kid who isn't making it at school. The kid who was a straight A student as a sophomore, now he's getting C's as a junior, and the family's worried about whether or not he's going to get into the college that they were hoping for. So it's a little bit different, but the bottom line is that all three of these substances can be very damaging to kids and can really cause a lot of problems for them, and things that would cause them to come into treatment, and things that we would want to help them avoid.
I know that our funder, the Office of National Drug Control Policy, our Drug-Free Communities grant, and in partnership with SAMHSA, encourages us to share the science and the research with the community, as well as promote environmental prevention strategies that can impact access and availability with youth. Interesting what you referred to with alcohol. I know there's been some significant progress in showing that youth who engage in binge drinking have a 10% decrease in learning and memory on certain tests. And I often say to parents and young people, that's the difference between an A and a B, or a B and a C. And that's researched and proven and related to cognitive ability. Another fact we share with young athletes, and as well as parents, is some research that says drinking to intoxication can negate up to 2 weeks of training effect. So where we are in our work is that we're taking the great work you do and sharing that research with families and young people, and hoping that those type of facts can encourage them to make healthier choices. So as you said, not only with accidents through impulsivity with alcohol, actual physiological impact of alcohol on learning and memory and athletic performance and mood, are realities with young people. We know that in Needham, the 2010 youth risk behavior data that we have indicated that the 30-day alcohol use rate and the binge drinking rate has decreased from the 3 survey submissions from 2006, 2008, and 2010. And that's great information to see that kids are making better choices around alcohol. But those numbers are still high, as they are in the state and as they are in the nation. So in Needham, Needham High School students in the last 30 days, 23% had reported binge drinking. And out of an N of 1,400 students, that's a significant number. So it's great to say we are seeing a decline in 30-day use and binge drinking. However, we're still trying to share the information that we have to continue to get those numbers to fall, because 23% is a big number.
Yeah.
The same with marijuana, and I'm going to ask you to expand on that. In the last 30 days, 23% of 9 through 12th graders had used marijuana. And those rates really aren't going down. And they aren't in the Commonwealth, as you know, and they aren't nationally, because marijuana is the drug of choice. So it would be great if you could share your expertise with us around youth and marijuana and what you're working with.
Yeah, so I would say, that there are several take-home points, but I think the most important thing is that these are potentially dangerous drugs. So a lot of people say, hey, having a few beers, no big deal, or smoking marijuana is not a big thing. Kids will say, well, I know my parents smoked and that sort of thing. I think it's important to keep in mind the fact that they are potentially dangerous. It doesn't mean to say that everybody who goes out and drinks on the weekend or everybody who smokes marijuana is going to have major negative consequences, but you're kind of opening the door to bad things happening and things that we don't want to have happen. I think that's why it's easy for people to understand. When you look at the percentages, really 3/4 of kids, as you were saying, or the way to flip this around is 3/4 of the kids realize that binge drinking is probably not a good idea. There's a reason why we shouldn't do that. But like you said, there's room for improvement. If 1/4 of the population of the kids in Needham are binge drinking, that's 1/4 of the population that's at risk for having things happen that we don't want to have happen to them. So we care about them and we want to help them get treatment if they need to. I'd say with the marijuana, it's really the same sort of thing. I mean, you're opening the door to potentially either developing a daily habit, which has long-term consequences cognitively, let's say, or can affect your mood, which will also have consequences. Or it could be just that people get used to managing their problems, coping with substances, and that is a problem. So they'll either continue to smoke daily for years sometimes, or they'll move on to other more dangerous drugs. An important thing to talk about is that in our program at McLean, people come in and they may have a problem with alcohol or they may have a problem with opiates, but when I sit down and talk with them, these are usually adults, but they will often have periods of time where they were smoking marijuana on a daily basis. And to me, that underscores the importance of, number one, the fact that this is a dangerous, addictive drug. It certainly can be. And number two, that we need to think about ways to try to treat that. And that's part of what we're doing. So we're doing clinical trials at McLean to try to develop treatments to help people either reduce or stop their use of marijuana. I wonder about whether or not for those people that come in down the road to try to get off of OxyContin, let's say, but they smoked daily in the past, if you're able to get in there, at that point where they were smoking daily, would you see them down the road? Would they end up in treatment? And I'd have to say that the numbers would probably be lower. I don't think that as many people would have these problems down the road if you're able to intervene with an effective treatment at that point. So that's what we're trying to do. I think the data is pretty clear for any of these drugs of abuse, that if you treat them with either counseling or medication, or better yet, a combination of both, people are going to do well. So that's why we're trying to develop that medication that may help people stop using marijuana. An important thing, again, to talk about with any of these drugs is that when people start to use them, we're not talking about binge drinking, but if kids are using more days than not, or if they're smoking marijuana multiple times a week, or God forbid, if they're using prescription opiates on a near daily basis, when they stop, if they try to stop on their own, which is commonly how it happens, people realize, hey, this is something that I shouldn't be doing. I don't want people to know about this. Let's see if I can stop. When they try to stop, they have withdrawal. So withdrawal is very uncomfortable. And it looks a little different for all three of those drugs, but in many ways it's the same. It's irritability, anxiety, there's some physical symptoms involved, and it's just general level of uncomfortableness that will often make people continue to use. If I'm feeling this way and I smoke, it'll go away at least for a while. So maybe I'll just keep smoking. Mm-hmm. So that kind of withdrawal is something that really causes problems, and it's something that we try to target when developing treatments. So there are treatments that are available for opiates that will alleviate opiate withdrawal, and we're thinking along those lines for marijuana. We want to develop a medication that will alleviate some of the withdrawal that's associated for people that are smoking on a near daily basis. And if you can make it so that they have less withdrawal, maybe that will help them be able to address the other issues. Is there a reason why I'm smoking on a daily basis. And so we want to look at those issues, but we also want to address the physical piece as well. And so an important thing to realize when we're talking about all this is that for all of these problems, there are treatments. So there are treatments that work. Doesn't mean that they work all the time, and we're not successful with everybody who comes through the door, but people can do well if they're in a place where they really want to do well, and if we do our job. And so, we try to hold up our end of the bargain, and we try to help people who want to get help. And if you have that combination of people that are passionate about trying to help people, and you have people that realize that there's a problem, they want to do something about it, people can do well, and they do. And so there are great stories of people who do really well. There also are more troubling stories where things don't end well, and those are things that we also try to educate people about. And again, you hear the stories about, so-and-so was out drinking and they did this crazy thing, but there are also instances where, there's a car crash or something like that. And so we're trying to make it so that we can avoid those instances from occurring as much as they do.
Mm-hmm. With our work, we look at risk and protective factors, and we know that parents are the biggest protective factors that a youth has, that an adolescent has. So we're encouraging parents to look at this information and to use some of these strategies to intervene with their young person when they're young. As you said, age of onset is a flag and has shown longitudinally implicates long-term dependence. I know with alcohol use, youth who start drinking before the age of 14, I believe, are 40% more likely to have an abuse and or dependence issue down the road. And you intimated that before 17 with marijuana, indicating the same type of thing. So what we're trying to do here in Needham with multiple strategies, environmentally implementing prevention initiatives, but also on an individual and family level, is to empower parents to look at their child, as you said, open up communication and intervene and make a difference before things get to the point that they may need treatment. And I feel like the work you're doing, and through our NIDA and Drug Free, we're able to share that information. In your work, I feel like you're also communicating the importance of parents and monitoring kids. Can you elaborate on the successes you've had?
Yeah, so family is key. I mean, a lot of times we have people come into treatment, either they are reluctant to get treatment or they ultimately give in and they come in to get treatment, but they will often try to dictate the terms. Well, I don't want so-and-so to know about it. Well, I don't want to tell my wife about it. I don't want my parents to know. And to us, that's something that we work very hard to try to help them understand, that this is a very serious problem that isn't going away. So these are chronic medical illnesses that are relapsing and remitting. And so that doesn't mean that we can't manage them and have you do really well, but in order for things to go well, we need to do a lot of different things. And one of the things that I think about is this concept of having all hands on deck. Mm-hmm. So the people that you live with have to be involved. Your family, they know you better usually than anybody else. So if you're going to do well, we need your parents, we need your family to kind of be involved. And so parents have a great opportunity if they can communicate well with the kid. They have a sense for what's going on and perhaps a sense for what might work. We work with the families as to get a sense for what they think might be helpful. So we try to bring the families in right away. We have weekly groups that families can come to get education, get support from other families who are in this situation like they are. But I certainly think that for things to go well, we need the families to be involved, and we need them to demonstrate that they care about their child so much so that they can make uncomfortable choices at times. Obviously it's a bumpy road, and there are many times when patients feel like their families are against them or that we're against them, and so that sort of thing. So there are all kinds of battles that are going on. We're battling with them to try to help them. Sometimes they might feel like we're battling against them, but we all want the same thing. Mm-hmm. And so that's something that I often talk about when I have an adolescent in the room with me, and they'll say, well, my family doesn't understand. They can't get it why I do this. They don't understand. And so, I can agree with them in some ways that they maybe don't understand the details or they don't understand the circumstances around which you're using. But I'll say I can be pretty certain that they want the same thing that you want. everybody, they want you to go to college, and you want to go to college. So is there some way that we can find some common ground and to help them help you? Mm-hmm. And I think ultimately people, patients that are in difficult spots realize that, hey, this person's trying to help me, my family, although we have our differences, they're trying to help me, and then eventually they open themselves up and allow themselves to be helped. Mm-hmm. Something that we talk about a lot is this idea that you can't worry by yourself. These problems are too big to expect somebody to handle by themselves. So God forbid they try to do it without any treatment. But even when they do come into treatment, like I said, a lot of times they're, well, I'll do this, but I won't do that. And so we try to help them understand that we need you to buy in to everything. I mean, you have to be powerless about the situation to some degree to be willing to accept some of the treatments that you might not want to do. It's not easy, and nobody wants to have to go to treatment every week or multiple times a week, but in order for things to work out well, which people want, this is what has to happen. And ultimately, I think people begin to realize that they need to do things that are sometimes drastic in order for things to turn things around.
Mm-hmm. In working with youth and parents, with the decriminalization of marijuana, I have oftentimes youth tell me it's really not harmful, marijuana, or years ago my parents smoked, or my aunt and uncle told me they never had any problem. Can you elaborate, since we're focusing on marijuana here, with historically a little bit and why our kids are more at risk?
Yeah.
In your opinion?
Yep. So marijuana, the idea of talking about marijuana and marijuana smoking, being somebody that this is what I do, I understand that it really stirs up a lot of affect for people. People have very strong feelings about marijuana, and part of it is because everybody knows people either that they smoke themselves, or they know people that smoked occasionally and they didn't have any problem, and so that sort of thing, and so they don't want to give up on that, or maybe they like to smoke occasionally, and I can't believe that something that I would do would be harmful. And I think it's important to say that I'm not trying to paint people with a broad brush in that sense. We're not talking about the occasional use. We're talking about people that take it to the next level, that are smoking multiple times a week. So even smoking a couple of times kind of opens the door, in my view, to more serious use of marijuana. And if you do that, if you are using multiple times a week or daily, that sort of thing, then we have very serious problems that are often around the corner. And unfortunately, by the time people come in to see me, oftentimes they've had the same kind of problems that they would have if they were drinking every day, or if they were using prescription opiates. And by that, I mean they've had problems in relationships, or they've had problems at school or work, or they've been kicked off the team, that sort of thing. So those are the outcomes, or worse. I mean, legal problems too is another thing that we see a lot of times. And so the bottom line is, people that have used marijuana and haven't had problems, but you can have problems. It can be very dangerous. It's certainly addictive. If you are smoking multiple times a week, you're going to develop the same sort of dependence issues that you would with other drugs. You need to smoke every day. There are people that get up first thing in the morning and have to smoke marijuana. So I think the take-home message is that it's a potentially very harmful drug. And I'd say that I try not to get involved with the laws and the statutes, but I will say this, that the marijuana that's available either legally in some other states or illegally, as in Massachusetts, is very strong. The potency has gone way up over time. So the marijuana that kids are smoking today is probably 3 to 5 times more potent than the marijuana that their parents smoked, if not more. So it's a whole different, the game has changed dramatically. The fact that there are people growing marijuana for states like California or Colorado means that there's a more scientific process involved, and so you're combining strains, and you're resulting in a very, very potent, very potent strains of cannabis, and those are the ones that kids are getting. So it's kind of apples and oranges in many ways. The stuff that parents smoked a few times a month back in the day is not the same stuff that the kids get on the corner, unfortunately. And so for those reasons, we try to underscore the importance of kind of being aware of what your child's doing and hopefully discouraging early initiation of use. We talked about the potential brain changes. And so these things are very real. Mm-hmm. And if they saw some of the carnage that we see, perhaps they'd think differently about their attitudes towards marijuana.
Right, right. Do you have in the few short minutes that we have, some signs and symptoms parents can look for with marijuana use, and perhaps before the treatment is needed, or just signs that they might react to?
Yeah, so I would say, you can kind of generalize in some ways to other drugs that kids might be using. So I think it's whether it be marijuana or prescription opiates or maybe stimulants or things like that, you're looking for changes in behavior. So things that your kid's doing now that he wasn't doing before. So is it a change in grades? Is this somebody who was doing well last year and now is really not doing well and we don't know why? Or is it a new group of friends that your child doesn't want you to meet? Is it an unwillingness to tell you about where they're going, is spending more time in their room, that sort of thing. So it's just kind of a kid not being themselves. And for those reasons, we try to help people understand that you really have to try to encourage a meaningful communication. We're not talking about texting back and forth in a superficial way. We're talking about talking to somebody. How are you doing? How are things going? To get a sense for things that may be frustrating somebody that might lead them to use, because kids often turn to drugs as a way to cope with situations that aren't going the way that they want them to. Are they not doing well socially as they would hope to, or they didn't make the team as they were hoping to do, or they're worried about a college application process. So those sort of things, and those are ways to cope with things that are uncomfortable, and it's an unhealthy coping mechanism that we try to discourage. And so if parents can kind of try to be on top of that and to look for these changes in behavior, maybe they can step in before things get out of hand.
Right. And a number of those same signs and symptoms we have available on our website, and resources for parents to refer to. But I like the fact that you said, open those lines of communication and look for these particular things. And we talk too in our field, and just to mention briefly about the stigma of parents maybe being hesitant to reach out. This can be a stopgap to later problems. So you in your work, I'm sure, say the earlier the better.
Oh, it's definitely. And one of the things that we talk about a lot, so there's a tremendous stigma involved with any kind of psychiatric illnesses or substance use disorders. And so, I try to frame these problems as chronic medical illnesses, just like asthma or diabetes or high blood pressure, in the sense that there are definite genetic components to these problems. Certain people are more susceptible than others to having an addiction problem. They may or may not express them depending on the other circumstances. But because there's a heritable component, you should treat them in a way that you would other medical illnesses. So you need to get intervention. You need to get, there might be a medication that you might need, but you need to think about this as something that you're going to have to manage over time. So you need to get treatment, and once you get treatment, you can't just kind of forget about it, because if you do, it's going to come back to bite you later. And so we try to help people understand that really these illnesses are no different than these other illnesses that are okay to talk about. So certainly people don't think about, hey, it's no big deal to say, hey, I have diabetes. Nobody wants to have that problem, but you're not afraid to talk about it in the way that you would, so-and-so is having a problem abusing Ritalin.
Right.
But in a way, they're very similar. And so we try to encourage people to get help like they would try to get help for these other medical problems.
Yes. We will certainly list your contact information in McLean and the great work you do in this segment, but you also are available information on our website, the Needham Health Department, Town of Needham. But also, I just wanted to say there are a number of great publications through NIDA and regarding marijuana that parents can access to educate themselves, and then hopefully empower them to talk to their adolescents about the best choices for their health and their long-term wellness. So I want to thank you so much for coming, sharing your expertise with us here in Needham, and I hope you'll come back.
Oh, thanks for having me. I'd be glad to be back at some
Thank you.
future point.
Thanks. Thank you very much.